Hi, hello everyone. I'm here with Dr. Greta Piculite again, and today we're going to address a question that we get asked all the time from guys who are looking for penis enlargement surgery. And that question is, how soon can they get back to sexual activity after surgery? Now, this is almost a two-part question, because most men who come for penis enlargement surgery, they have the length and the girth increased together. So let's start with that. So after length and girth surgery, how soon can they get back to sexual activity, Greta?
We can get back as soon as 1 month and a half.
Okay, so about 6 weeks or so.
That's right.
Yeah.
Meanwhile, they shouldn't get involved in neither masturbation nor any other sexual activity. Then they get an erected state of the penis. Because it's quite risky, as that may cause migration of either the fat transfer, or it can cause some other complications associated with the surgery.
Okay, perfect. Well, obviously, after you've had your surgery, we have our own patient care department that are in contact with you continually, just to make sure that everything is settling down and if you've got any questions. And of course, our patients have a follow-up appointment with the urologist at 1 month. And certainly there's no sexual activity within that first 4 weeks at all. And then we generally review things at 4 weeks. But as Dr. Greta said, for length and girth patients, it is usually 6 weeks. Now, the advice is slightly different, isn't it?
Yes.
If they're having just the fat transfer without the lengthening, without the cutting of the suspensory ligament.
Yes. If you have both procedures performed, you should stay away slightly longer.
And for fat transfer only?
For fat transfer only, you should stay away for a month at least, but ideally for 1 month and a half as well. And for lengthening, you should stay away for 1 month and a half or 2 months.
Okay, so there you go. So 4 to 6 weeks, no sexual activity is a really important part of your aftercare. Of course, we're with you all the way after your surgery. We keep in touch through our own patient care department. So if you have any questions during the course of your recovery, we're always on the end of the phone for advice and help. Of course, you can always take a look at our forum, which has a lot of activity on there, lots of questions and lots of answers from patients who've already had surgery and also guys who are thinking of having it done. And you've got some advice on there from our doctors and our urologists. We also have a patient resource section with lots of information there about how to deal with post-op issues or any help you need, and you can go to www.moorgateandrology.co.uk and take a look at our patient resource section. I think you'll find that very interesting. Well, that's all from us today. We'll see you next time here at Moorgate Andrology. Thanks for watching.
Thank you.